Hey guys, it's Derek Z. Welcome back to another video. This is part 2 of non-surgical ACL rehab. In this video, we're going to be focusing on strengthening of the quad and your lower extremity. The majority of the exercises are going to be focused on activating the quad at the beginning and then progressing towards strengthening in the lower extremity. In the previous video, the exercises were focused on improving your range of motion in terms of extension and flexion. And in this video, the following exercises is going to start with activating your quad first. So the first exercise that we do to activate the quad is the traditional quad set. This is the exercise in the previous video that we also use to help improve knee extension because they go hand in hand. So if you're not doing this already, we need to be doing this in the beginning phases of the rehab process. So for the quad set, to review this, very straightforward. Prop your ankle up, take this muscle, apply a little bit of a squeeze in it by pushing the knee down into the table. When you do that, it pushes the knee into extension and you activate the quad at the same time. You know you're doing it right if you palpate around and poke around your thigh muscle. That is your quad. If that feels firm and hard, then you're essentially engaging the quad and you're activating it. So you want to hold this. I have my people hold this for 10 seconds. Usually have them perform about 10 times. Another way to add more bang for the buck when you're doing this is point your ankle towards you. Now you're engaging. You get a little bit of a calf stretch in the back of your thigh. And then now engage the quad. You get even more knee extension and more quad activation because you're generating more tension out of this. Once you get the quad set down, then what you want to do is you want to progress yourself into a straight leg raise. So a straight leg raise is just the way it sounds. You lay on your back, prop the other knee up to help protect your low back, point your ankle towards you to get the leg to be as straight as possible. When you're doing that, engage the quad. So then you're doing the quad set exercise and then lift this up to the height of the other leg and then just knock out reps from there on out. I usually have people do about 30 of these if they can tolerate it. The goal is to not let the knee bend when you're doing this. So if you're doing that, that would be incorrect because then the quad's not engaged all the way, not to mention the knee is not straight. So it's not in optimal position. So you want full knee extension when you're doing this, lock that quad out and that knee out, and then do the straight leg raise. Don't relax the leg on the table when you're doing this. Just tap the heel on the table and then bring it right back up from there on out. Once you get good at the straight leg raise, we progress into the long sitting straight leg raise. So the long sitting straight leg raise, you sit up at the edge of a table or just with your knees bent and hanging like this. And then what you do is you point your ankle towards you to generate tension in the back of your leg there. Point it up and then lift it up from there on out. Make sure when you lift up, don't slouch back. You want to sit up straight, engage the core, tighten that up, and then point that leg up. Make sure the bottom of your thigh is above the table. Hold it there for 10 seconds, and then you relax and you perform for 10. Once you get good with the long sitting straight leg raise, at that point you should have enough quad activation to be able to stand weight bearing. So we're going to go into weight bearing with just a basic squat with a band around the knees. You want to push out. So with squatting, get your feet about shoulder width apart, have the band a little bit above your knees. And then before you start, make sure you put tension on the band first. When you do that, you put the knees in better alignment versus having them knocked in. So you don't really want to do that. Push out. As you push out, you actually get some glute activation as well too. So when you're doing this, you get more bang for your buck. And then as you're going down into your squat, you go down into it, keeping tension on the band, and then you coming back up. Again, I usually have people do this for about 30 times. Once you get the squat down, what you want to do is go into a split squat or a lunge. So let's just say the left leg is the leg that's the affected side. You bring that forward, bring this back as far as you can go. Make sure there's a little bit of width in between. So meaning don't have your stance too narrow, because what happens is you end up losing balance or you're challenging your balance a bit more than what you need to. Have a little bit wide so then you can balance that out and get more reps in. So starting off from the side, you want to just go straight down when you're doing this exercise. And again, I usually let people do this about 30 times, and then you switch to the other side when you're doing this. So make sure when you're going down onto your lunge, your body weight drops straight down. You don't go forward, nor do you lean back into it. Once you get good with the bandit squat, then we're going to progress into the rear foot elevated split squat, or the Bulgarian lunge is another name for it. So with this exercise, you need a surface that's about this high. The edge of it would be somewhere behind your knee, or just a little bit above your knee, behind on the lower thigh. So what you do here is you sit down first, and then you get up and you put one foot forward and then the other foot forward, and that's the distance that you need to perform this exercise. So to perform this exercise, you take one leg back, so that's the distance that allows you to perform this lunge correctly, and then you just go straight down into it. So the mechanics for this exercise is exactly the same as the regular split squat in terms of where you drop down. The only difference here is you're just focusing the load on that side. When you do this on both sides, and then I usually have my folks do this 2 sets of 15 on each side, alternating. You do what you're comfortable with. Progressing on to the next thing from the rear foot elevated split squat would be the Y balance exercise. So the Y balance exercise is a nice exercise that's actually supported in the literature to help strengthen your quad and develop balance for the lower extremity that's involved. Highly used in the clinic, at least for me, for my patients that are recovering from an ACL injury. So with the Y balance, you need some tools for this. Right here, I have a slider. If you don't have a slider at home, all you need is a slippery floor and a towel. So you would just replace this with a towel. So with this exercise, you're just creating a reverse Y, essentially. So I usually start with my hands on the hips, and then you go straight down, bring it out as far as you can, go out this way to where my 4 or 5 o'clock is, and then from there go out that way to where my 7 or 8 o'clock is, and then that would be 1 rep. And then I usually have my folks do this about 10 times on each side. So that again would be my 2nd rep, and then you repeat on the other side. Now we go into a small single leg squat progression. Once you get pretty good at the Y balance, then we progress into this lateral step down. So I have a 6-inch box here. That's how far this is from the ground. So to make this easier, you just make the box smaller, or you can find a smaller step. And to make this harder, you make the box a little bit higher so that you get more height. So to do this exercise, you start off, again, the left leg is the leg that we're working on. So essentially what we're doing here is you just go hinge into it. You go straight down, slow and controlled, making sure your hip, your knee, and your foot is all one straight line. Make sure when you're doing this, when you're going down into the squat, your knee doesn't cave inward. So what I mean by that, this doesn't happen. So to prevent that from happening, you just make sure your knees are aligned with the 2nd toe. So make sure your knees are not on the inside of your foot, because if that's the case, then you're going into dynamic genital valgus, which then just puts a lot of strain on the ACL or just on the knee in general. It's okay if it goes past the toes a little bit, that's fine. We're not really too worried about that, but essentially what you're trying to do is slow and control, tap the heel, and then bring it right back up when you're doing this exercise. So this is not really busting out reps. We're trying to do this about 10 times with a lot of intent to maintain alignment. So when we're doing this, make sure your hips are going back, maintaining good alignment, get a little bit of glute activation and the quad as well. And then 10 on this side, slow and control, 10 on the other side, slow and control. Getting to a single leg squat is typically the ultimate goal for the majority of my patients that are undergoing non-surgical ACL rehab. So I want them to have a single leg squat that is comparable, if not the same, to the other side. So that tells me that they can at least have a similar level of quad strength compared to their non-injured leg. So typically with the single leg squat, I have them do it just on the floor first, and then I have them just bring the other leg up. You can use something for balance just to hold on to start off with. So I have them have their hands on their hips and then go down right into it. The mechanics of this exercise is similar to a lateral step down, the exercise before. Once you get comfortable with this, then you take your hands away, the progression from this, and you just go right into it. This will add balance into it. You see how the knee wobbles a little bit. So if it wobbles, that's okay, but you just don't want that to happen. You don't want the knee to cave all the way in. Lots of stress on the knee, lots of stress on the ACL when you're doing that. So when you're doing this, make sure your hips are going back. The knee is staying in line with the second toe. It's okay if the knees go forward past the toe. That's fine, as long as there's no pain when you're doing this. When I have my folks do this, I start them off 10 at a time on the involved side and then onto the non-involved side so they can at least see the difference. After these strengthening exercises, I would expect there to be some soreness around the knee. The soreness that I'm talking about, I'm referring to the soreness in the muscles of the knee. So around the thigh, the calf, the hamstrings, in the back. If you experience soreness, that's within the knee joint itself, not within the muscles. And then if there's a little bit of swelling around the knee, then the intensity of these exercises may be a little bit too much. So you might need to back off a little bit so you don't irritate the knee, especially because we're trying to work with an injury. So if that is the case, feel free to use ice 10 to 20 minutes per time. Do that 2 to 3 times a day to help try to manage that swelling. If there is some swelling and pain, maybe take 1 to 2 days off. That's typically what I advise my folks to do. If you're already working with a physical therapist or you have an orthopedic doc, make sure you're checking with them if there is some swelling or some pain, especially if it's not going away. So if that's the case, then check in with them and then just stop the exercises completely. That's all I have in terms of the strengthening for non-surgical ACL rehab. If you have any questions, please feel free to leave them in the comment section below, and I'll see you guys in the next video. Thanks for watching.